I am so honored to receive the Dr. Leslie L. Weiss Distinguished Physician Leadership Award and would like to sincerely thank the Morton Plant Meese Foundation for this special recognition. In accepting this award, I'm inspired to recall the words of Sir Isaac Newton, who reminded us that we stand on the shoulders of giants, that our advancements are built upon the work of those who came before us. Indeed, such giants as Sir John Charnley and Dr. William Harris were pioneers who, through their leadership and guidance, developed and refined modern joint replacement surgery. It was then left to future generations to stand upon their shoulders and to improve the delivery of those systems to our patients. And so to that end, I would like to also thank the Foundation for their investment in orthopedic technologies, thus making them available and assisting us in fulfilling this responsibility. When I first started at Morton Plant Hospital in 1994, joint replacement volume was relatively low. Back then, it was a lengthy procedure involving large incisions and significant blood loss. Blood transfusions were often required, and patients would stay in the hospital for 7 or even 10 days before virtually all were transferred to a rehabilitation facility for an additional 2 or 3 weeks of physical therapy. Complications and readmissions were common, and patients required high doses of narcotic medication to control their pain through a long recovery process. No wonder back in those days, many primary care physicians recommended to their patients that they wait as long as they could until they couldn't stand the pain before even considering this surgery. Well, today things are radically different, as now over 3,000 total joint replacements of the hip and knee are performed each year at Morton Plant and Meese Dunedin hospitals alone. Using less invasive techniques and modern technologies such as robotics, rapid recovery and improved outcomes are the norm. 96% of our patients are discharged directly to home, most within a day, and a full third go home on the same day as their procedure. 30% of them experience a recovery without the need for any narcotic pain medication whatsoever, and furthermore, the rate of complications, blood transfusions, and the threat of readmission has been significantly reduced. Now, arriving here was no simple task, and I noticed from reviewing prior videos of acceptance speeches at this point, the award recipients typically begins to thank their partners, colleagues, and nursing staff and others, like Chris Edelman, my PA, and Jessica Childress, the best surgical coordinator, and without either of whom I simply couldn't function. They thank their families, including their children, such as mine, Mackenzie, and Caden, of whom I am extremely proud. And more importantly, they thank their wives for helping them make all this happen. And I do thank them all sincerely for their support and cooperation. But those of you who know me are likely aware that my interpersonal skills, my communication techniques, and my emotional intelligence are often lacking. And because of this, my leadership style has generally defaulted to one of simply leading by example. Well, as medical director of orthopedics, I realized that making the systemic changes necessary would be a complex endeavor and would require greater influence than a simple demonstrative leadership style could achieve. So it is with undying gratitude that I want to thank my wife, E Kilgore. As a physician assistant and then manager of the orthopedic service line, she shared with me a passion for what we knew was possible. With her complementary leadership style, together, we were able to gain consensus among the various departments and disciplines across the entire health system and accomplish something that otherwise, I believe, could not have been achieved by either of us alone. Today, I owe Erin an even more outstanding debt of gratitude, as she has graciously sacrificed her education and, more to the point, her career, her dream job, to care for our children, run our household, and allow me to continue in my profession. And finally, I would be remiss if I didn't recognize the influence of my late father, William Kilgore, who many of you may remember as an orthopedic surgeon who began practicing here at Morton Plant Hospital in 1963 and served on the boards of both the hospital and the foundation. He imparted to me a principle upon which I have always tried to follow in my practice, that true experts should remain aware of the limitations of their knowledge, and that this should in turn foster a continual desire for learning and improvement. And indeed it has. Thank you.